Welcome back to the Natural Doctors. I'm naturopathic doctor, Dr. Jen Stagg.
And I'm naturopathic Dr. Katie Dinello. Welcome. Today we're talking about beyond cholesterol. So all about heart health. And it really is so much more than just cholesterol, right? So Dr. Jen, take it away.
Yeah. So, I mean, for years, there's been this focus on LDL cholesterol and a very targeted number specific. And if you go to your doctor and you have a cholesterol panel, just, oh, what's your LDL? You meet the criteria, we should lower that LDL. And so that's been the story that a lot of people sort of understand in terms of heart health. And that story is has changed quite a bit. And even in cardiology, it's changed a lot. So even the concepts of statins now, of course, they lower LDL cholesterol, but they also have effects on plaque stabilization and they're anti-inflammatory. So they're doing a lot more, right, than just lowering LDL. There's also a lot more even to consider in that picture. So even, tell us about heart attack patients, like how they present and what LDL can look like for them.
Exactly. Yes. So I'm not going to lie, talking about cholesterol kind of makes me uncomfortable. And that's because medicine in general doesn't fully understand cholesterol, right? So for example, as Dr. Jen said, 50% of patients coming into the ER having a heart attacks have normal LDL cholesterol. When we say LDL, we mean that bad cholesterol, right? And that's wild, right? When I heard that statistic, I was shocked because I just thought, oh my gosh, everybody who's having a heart attack has high LDL cholesterol. But that's just not the case. And that's because there's other things like inflammation coming into play, gut health, right? Oxidative stress, a lot of other factors. So we can measure a lot of other different things, right? It is so much more than just that LDL. So for example, I know you do this as well, Dr. Jen. We order a test called Cardio IQ. And on this test, not only are we looking at your total cholesterol and that LDL bad cholesterol, but we're also looking at the size of that cholesterol. So when it comes to cholesterol, the size of that particle really matters. This is a little biochemistry, so just hang with us, everyone. But when those cholesterol particles are smaller and denser, they're more atherogenic, which means they have more of a risk of causing a heart attack or a stroke, right?
Yep, absolutely. And so it gives us a much better picture of what's going on with patients. And then that cardio IQ profile also has a lot of other indicators on it as well, like inflammation. And there are also tests that we can now look at that even look at metabolites in the blood that have to do with gut health. So that's where I want to go next. So even beyond doing a cardio IQ, which if your doctor is actually running that, that's amazing. But this is where naturopathic medicine really shines with heart health. This is where we really look at the whole picture, looking more holistically. And historically with cardiovascular disease, with autoimmune diseases, with pretty much like everything, naturopathic doctors are like, oh, it all starts in the gut. And that is really what the science is showing us now, is that gut health is really important for heart health. And that's a story that I feel like not many people understand. And they're certainly not hearing that from their doctors, unless they're seeing a naturopathic doctor or an integrative medicine doctor.
Exactly.
So microbiome is certainly, all over the place. It's on social media. Take this supplement for your gut, all that sort of stuff. But let's talk about it a little bit more at a basic level in terms of what, and specifically what's happening with the gut and these metabolites. So when bacteria in your gut produce these metabolites. Some of them are not so good, and then some of them are good.
Yeah.
And those really come from the types of bacteria that are in there. So when we talk about having a really healthy gut, quantity can be important in some cases, but it's more about the diversity and the types of bacteria that are in there. So first of all, we have butyrate is something that gets produced. And when there are high levels of butyrate in the gut, then we're going to see more of that anti-inflammatory effect. Like it actually does carry over and affect the blood vessels. But we have something else called TMAO, a not so good metabolite. Here we have, like research shows, a 2.5-fold increase in cardiovascular disease when people have elevated levels of TMAO. So do you want to talk a little bit about what's going on there?
Exactly. Yeah, I love this. This is such a big topic. So, you know, when it comes to the diversity of your gut, good gut bacteria is going to help us, you know, produce butyrate, which is, like you said, that short chain fatty acid. And so when we eat really great foods, right? Whole grains, sweet potatoes, quinoa, lentils, chickpeas, these are all great foods that feed our good gut bacteria so that they produce short chain fatty acids like butyrate. These short chain fatty acids are food for our cells lining our gut. And so when we have a healthy gut, that prevents us from getting leaky gut. And that's what can prevent cardiovascular disease in the long run. So then we have these bacteria that produce things like TMAO, which is a particle that not a lot of us have heard about, but we can measure that, right? It's a very easy test that we can get done at our local labs. So that's very cool. And we're measuring that in a lot of our patients. The other thing too is LPS, right? Lipopolysaccharide. LPS is a toxin produced by bacteria, by bad bacteria in our gut, right? And that causes systemic inflammation in our arteries, which can contribute to cardiovascular disease. So it's so nuanced, right? And this is just one example. And then, you know, we'll do a whole lot of episodes on SIBO, but we know that when we have SIBO, which is a type of dysbiosis or alteration in our gut microbiome, that's associated with cardiovascular disease, arrhythmias, higher rates of heart disease. So there's huge implications here when it comes to gut health and cardiovascular disease.
Absolutely, yeah. So it seems like I think patients are surprised that they would go and see a naturopathic doctor about their high cholesterol, and we would start like talking about stool testing.
Right? Yeah.
Right? Let's look at your gut. And they're like, oh, I don't think there's anything going on in my gut. But stool testing can come in handy here. Testing for leaky gut, that's something that's very valid to do. As you mentioned, if you have a leaky gut or increased intestinal permeability, then, you know, those elevated levels of LPS can actually damage those blood vessels. And we're going to talk about those blood vessels and the integrity of the lining here in a minute.
Yeah.
But I think people really need to start understanding that connection, and even the oral microbiome, right? So here's a whole other thing to think about is the health of the bacteria in your mouth, and how research has shown that increased levels of oral pathogens, so not so good bacteria in the mouth, actually increase the risk of cardiovascular disease, 50, up to 50% in some of these studies. And then the other thing is that they're finding these oral pathogens in plaque, which isn't that crazy?
It's wild.
Yeah.
It's absolutely wild. I feel like absolutely no one is talking about this, right? And I even had to go through extra training in functional medicine to even hear about this topic. So it's a big deal, right? It's not just, you know, like, oh, do we have a cavity here or there? No, if we have periodontal disease, that is a risk factor for having a heart attack or a stroke, right? It's super important.
Yeah, absolutely. Yeah. So those are some things to think about. Like if you're working with a naturopathic doctor, you're working with an integrative doctor, your primary care doctor is probably not going to test your microbiome.
They're going to be like, that's probably important, but I don't.
It's not this. So, but they might refer. They do refer to us. So,
They do.
Something to consider there. But let's talk a little bit now about the lining of those blood vessels. So how we end up with plaque in the first place, right? So those vessels are basically lined with something called a glycocalyx. So here's another term you don't hear much about, but basically this is cushioning for the lining of your blood vessels, made up of sugars and proteins. And some of our favorite things to talk about, inflammation, oxidative stress, LPS, these things can damage that lining, right? And so when that lining gets damaged, this is how you have that set up for plaque to build in there, right?
Exactly.
Yeah.
Yeah.
So,
when you have a nick in that glycocalyx, that's where that plaque can start to build up, and that plaque is what then causes blockages. But I like how you said when that glycocalyx is really healthy, it's like a cushion, right? It really protects the lining of that vessel. And I can't get through an episode without talking about food here, but it is healthy foods, right? Those dark berries, those dark leafy greens, things with vitamin K, proanthocyanidins, right? Antioxidants. That's one of those things that's keeping that glycocalyx really healthy.
Yep, absolutely. So when we think about like keeping that vessel intact, there are specific food groups that we think about. So just like you said, these polyphenol rich foods. So for years and years, I feel like people let's talk about alcohol a little bit here and red wine. Okay, so the story has changed a bit, but so this concept of red wine basically it has some polyphenols in there. So there was this correlation with, this is probably healthy for your blood vessels, right? But a lot of other foods have polyphenols. The alcohol itself is not healthy for your blood vessels.
Yep.
So that story about alcohol, for any of you who have not heard this, alcohol actually does increase your cardiovascular risk. Yeah. So if you're drinking like more than 2 drinks a week, you could potentially be having cardiovascular risk from that. So like you shouldn't be using red wine as a healthy strategy.
Exactly. No, I mean, we're laughing here, right? But this is a really important topic, and it is something I talk about multiple times per week in clinic. So yes, red wine, it's got the polyphenols, but we can get those polyphenols through supplements if you really want to, right? We've got some really fun herbal, products that we can use that are very sweet. You can put them on toast, right? Put them into smoothies, or just use good old whole foods, right? Those dark colors.
Exactly. Like you said. So this is where you think about these dark berries, blueberries. Like a lot of people understand blueberries really being great for your vessels. Yep. And this is what this story is, right? It's the glycocalyx. It's really supporting the health of the glycocalyx, that cushion in the blood vessels. Another big food that people, I'm cutting off their alcohol, I got to give them something, is chocolate. Yeah. Dark chocolate. Okay. So dark chocolate, very rich in polyphenols, a much better way to think about enhancing heart health. And that's working on that glycocalyx as well, right? But talk about dark chocolate a little bit and like what you should be looking for with dark chocolate.
What we're looking for here. I know. And I will be the first to admit, and I tell all my patients this, I absolutely have a sweet tooth. My family knows this. It is my weakness. So I have dark chocolate pretty much every night. But the darker, the better, right? That's what we're really looking for here. Because it's that cacao powder that is very rich in polyphenols. So, I mean, I know the higher the percentage of the dark chocolate, right? Like 95%, it does get a little bit more bitter, right? And that bitter means that it's medicine, right? I tell all my patients that, especially when I give my patients bitter herbs to take, that bitter flavor is what you want. So we're talking 95%. Is that kind of what you go for?
Yeah, I mean, yes, exactly. The higher, the better. And so, like, yes, I'll eat stuff that's like basically 100%. But I do say like 70%. Like, make sure it's at least over 70 and look for lower sugar content, of course, right? Because then the sugar is actually bad for that glycocalyx, which we'll talk about in a second. But some other things, green tea, pomegranate, right? These are really good sources of polyphenols.
Yes.
Now we're going to go to another one of your favorite food categories, sulfur-rich foods.
Yes. My cruciferous vegetables.
Yes,
these are really important, right? So these are your broccoli, your cabbage, your kale. Eat these foods. They're so beneficial for us to support those arteries. Yep. Absolutely.
That's great. We love those. Garlic and onions too.
Omega-3s
are big here. So that's another great thing to help protect rebuild. So also, you know, if the glycocalyx has gotten damaged, then, you know, like we think about rebuilding that, right? So these are things that people can start to add into their diet. Chia seeds, flax seeds, you know, all these great sources of omega-3s, sardines.
I am always so impressed when a patient comes to me and they're like, oh yeah, I have sardines.
I know.
It's amazing. Good
Same.
for you.
I love that.
I won't do it. I do want to also talk about nitric oxide.
Yes,
because this is an important piece when it comes to the health of our glycocalyx and our vessels. So we really want to make sure we have enough of that in our arteries because it keeps them nice and open, nice and patent. And the reason why I bring that up now as we're talking about food is because beets are actually a fantastic source of this. We actually have test strips in our office where you can test these levels in your mouth. It's really simple. These strips also give us an indication into how healthy your oral microbiome is, which is what we were talking about earlier too. So that's an important piece. But beets are a great way to increase those levels as well.
That's great. Love that. Finally, on this whole like glycocalyx story, I just want to end with talking about blood sugar control here. So this is where the story correlates really. So when we think about patients that are pre-diabetic, diabetic, you know, a diabetic patient is going to have high risk of cardiovascular disease. And it's not just because a lot of times they have elevated cholesterol. It's because the high blood sugar damages the glycocalyx. And so then you have this setup with the damage where plaque can build, right? And they have like higher levels of inflammation. That's another thing, you know, we were talking about inflammation markers. CRP will elevate because of this LPS too. So that whole like gut connection, when LPS is high, TMAO is high, you're likely going to have a cascade of inflammatory effects that will show up with a high CRP.
Exactly.
So in terms of food choices, again, you know, we've had a whole episode talking about anti-inflammatory foods and blood sugar control, which I'm sure we'll like have a whole episode on that specifically.
Exactly.
But this is where we would want to think about starches, total amounts, where these carbs are coming from, processed carbs, actual sugar content, those sorts of things, right?
Yeah, I love this topic, right? And when we think about that HSCRP or that CRP molecule that Dr. Jen was talking about, what a lot of people don't know is that molecule or that level is actually becomes more predictive of cardiovascular disease in women over 60, 65 years old than your LDL does. So back to what we were talking about at the beginning of this episode, right? That cholesterol profile, it's so much more than that. Is your doctor looking at that HSCRP level, especially if you're a female over 60, 65 years old?
Yep.
That marker really, really matters.
It's so important. I love that we're talking about that. So what we need to get to next, and you know, we're going to end the episode here talking about stress, the nervous system, heart coherence. We always love to talk about this. And this is often a lot of times the elephant in the room for patients, right? Like they're exercising, they're eating the right foods, they're taking supplements, and they're trying to figure out like, okay, well, why are things off? And a lot of times we're not dealing with stress, right? So stress is a really big factor when it comes to cardiovascular disease. It can raise your risk by up to 40%. And then there are some other measurements to think about here as well. I'll talk a little bit about heart coherence, but maybe touch on broken heart syndrome. A lot of people don't know what that is.
Yes, exactly. My gosh. I've had a couple patients now who have had broken heart syndrome, and it is a form of a heart attack. But instead of having a blockage in your arteries, right, instead of having high cholesterol levels, you actually have what we call vasospasms, or spasms in your coronary arteries and those blood vessels bringing blood to the heart. And it's from stress, right? And so this is such an important piece to talk about, because you're right. So many people come to us, they're like, I'm so healthy, I'm eating all the right things, I'm taking the supplements. But then when we say, okay, well, tell me, Are you anxious? Are you stressed, right? What's your work-life balance like? That's where things kind of break down, right?
Yeah.
Because let's face it, we're all really stressed. We live in a stressful society, and it's really hard to get a grip on sometimes. So it's important to talk about with your doctor.
Absolutely. And this kind of leads into this dysregulation in the nervous system, right? So people are stressed, they're living in this fight or flight, they have an imbalance in that sympathetic, like, nervous system that's on overdrive and not enough of the parasympathetic. And this is a concept talked about as heart coherence. And so this is where your brain and your nervous system and your heart are all sort of like in sync. And for people that are, chronically stressed, this is something we really want to talk about, and we can actually teach some breathing that is heart coherent breathing, right? So this is this method where you're doing slow breathing. So a couple of different things need to come together, right? You have to breathe very slowly. You have to have a positive emotion, of appreciation.
Yes.
Be like, this is the best emotion to really get your nervous system aligned. And doing those deep breaths are really important. And also then visualizing breathing sort of through your heart. And that can help regulate that nervous system. And we can actually measure your heart coherence. A reflection of it is heart rate variability, right? So that's something a lot of people can look at on their wearables, right? They're looking at this on their watches, on their Oura rings.
The Whoop, I think, does it. Yeah.
And when I first started looking at my heart rate variability, the one thing I figured out that actually improves my heart rate variability is literally laying down doing nothing. So meditation, 10 minutes, if I can take 10 minutes, and certainly meditate is even better, but literally lay flat, don't look at your phone, do nothing. The days that I am incorporating that, my heart rate variability is pretty good, but that's when I can get really good scores.
Yeah. It's the same for me. And it's the same for so many of my patients. Anytime my patient has a wearable device like an Oura ring or something, I have them measure this. And then we do little experiments to see what can improve their heart rate variability or their heart coherence. And you're right, meditation is one of the best things to improve HRV. I absolutely agree. This is a hard topic to talk about with patients, though. How do you start that conversation with patients and ask them about it?
Yeah, I mean, a lot of it comes down to, I guess the relationship, right, that we have as naturopathic doctors, where we're invested in them as a person, right? So a lot of times when they come in, one of the first things I'm sure you're asking too is not just okay, I've got your labs here, let's go over them. No. It's how are you, right? What's going on in your life? Let's talk about the things that may be causing you stress, right? Exactly. And so this is part of a naturopathic encounter always. Yep. And so it flows well. Some of the other things, I know we're going to get pretty short on time here. So I do want to just touch on that, some of the things about connection to nature and connection to community, which are also really important where it comes to heart health and things that we can do to sort of just make sure we're thinking about this in a very integrative way, that this is all one thing. These are not just separate things. All of this is linked. But there's research showing that having a sense of purpose and a sense of connection is very important. It's a big risk factor for mortality. Yes. So even more so, this lack of social connection is worse than being a smoker and worse than being obese, right?
Yeah, and we get a lot of this data from the blue zones, which are these pockets of the world where a higher percentage of the population is living longer, right? And we know that one of the core tenets of these blue zones is that the people living there feel super connected to each other, and they have that great sense of community. It's important. I think I'll end on a kind of a funny note that I experienced this morning, which I thought was really encouraging. I was at the gym walking on the treadmill, and there was a woman she works out there most mornings too, and she brought in zucchini from her garden and was giving it to everybody at the gym. And it was such a nice moment. And it really reminded me, as I was kind of thinking about filming this episode tonight, I said, like, that's it. Like, that is it right there, right? We're growing our own food. We're sharing it with the people we're surrounded with. We're moving our bodies. I thought it was a really nice embodiment of everything we're talking about.
Oh my gosh, I love that.
Yeah.
That's so beautiful.
Oh, sweet.
Yeah, I love that. Yeah, so really, some of the practical steps are just to sort of, clue up here. We really want to be eating those healthy vegetables, eating adequate fiber, really enhancing that microbiome. We want to really nourish our vascular health with all of these sulfur-rich foods, the polyphenols, these practices of relaxation, quiet time, and then of course that social connection. So really, we've talked about this, is that it ultimately comes down to like taking inventory of your life, right? Yeah. So I think, ultimately this is where people need to make decisions, right? About like what their priorities are, and if they want to live a long time and be free of illness, there's a lot of foundational pieces that really need to come together, right?
Exactly, 100%. Take inventory of your life and make really intentional, purposeful decisions for your health. Yeah.
That's great. Well, thank you so much for joining us. That's all we have for today. And please join us next time for the next episode of The Natural Doctors.
Step into our store and discover a stunning array of dancewear. Introducing Dancingly Yours, your one-stop shop for all things dance and delight for ages 2 to 92. From tiny tutus to energetic tap shoes, our store is a treasure trove of dance essentials. At Dancingly Yours, we offer an extensive collection of dancewear and accessories that cater to all styles and levels. We carry top brands and the latest fashion trends. From ballet to hip-hop, lyrical to jazz, ballroom to liturgical, as well as gymnastics, you'll find the best selection right here at Dancingly Yours. But we're not just a store. We're a community that celebrates the joy of dance. Our expert team is passionate about dance, just like you. So we're here to assist you in finding the perfect fit. And the best part, Dancingly Yours offers competitive pricing in-store and online. Dancingly Yours, easy to get to, and worth the trip from anywhere, right on Route 10 in Plainville.